I'm Dr. Greg Borschel. I'm a plastic surgeon at Riley Children's, and I've been in practice since 2006. So why did I become a doctor? In my family, we had kind of a long tradition of service, and growing up around Indianapolis, I was fortunate enough to volunteer with some plastic surgeons, and it just felt like the right thing to do. So even going into medical school, I knew from the outset that I was going to be a plastic surgeon. And then that kept my interest up, and then that developed further, where I discovered that within plastic surgery, there's this field of pediatric plastic surgery, which I found just naturally attractive. And it gave me the opportunity to try to explore some of these problems that patients and families have been facing, some of these more complex, more rare, kind of difficult challenges. And I just found myself naturally drawn to these kinds of problems, especially given the issue in pediatric plastic surgery, where lots of families have found that there aren't a lot of resources out there for some of these conditions. So a lot of families want to know what to expect when you come see me in the office. And basically it's pretty simple. You know, we'll sit down, we'll have a chat about what's been going on. You may have seen other doctors and other surgeons for your child's condition, and that's okay. We'll go over all that. We'll go over other records that you may have, and then we'll take a look at what's going on. Just to warn you, there may be a number of people with me. It's common for us to have kind of a team. I'll have nurses with me, therapists, my associates, so don't be surprised if there's a small army of people with me. And the reason for that is that we're all there to take care of your child. So it may seem a little bit intimidating, but they're all there for a reason. They all have a role, and they're all there to hopefully get the best outcome for your child. The interviews vary in their time, so some are pretty quick. If it's a more routine kind of problem that we can assess pretty quickly. And sometimes people come in with really complex problems, long histories, and this kind of thing. And if that's the case, don't worry, we'll take the time. We'll go through all the issues, unpack everything. And there may be all kinds of issues that you may not even think are relevant, but they might be. If that's the case, we'll go through all these things step by step. And then, in the event that we're talking about maybe doing surgery, we'll talk about what to expect. What to expect in the days leading up to surgery, what to do, what not to do, what to expect the day of surgery, and what to expect afterwards. And these are all really important things. I mean, nothing's more important to you than the health of your child. And my job primarily is to let you know what's going to happen, what to expect, what is this diagnosis that maybe not a lot of people have heard about, and it's okay. So be prepared to spend a fair bit of time in the clinic leading up to surgery. That's typical. And be prepared to talk to a lot of people because, again, nothing's more important than the health of your child. So what do I love about my job? Well, there's a lot of things. But I would say first and foremost, I love working with my partners and my staff. We've got a whole bunch of people at Riley that are dedicated to improving the health of children. And when you come in, you'll see them. You'll see a lot of these people, some of which have been working there for decades. That says a lot. These are highly skilled professionals, wonderful people, compassionate people, and I feel very privileged to now be working among them. The other thing that I really like about my job is seeing the kids grow. And nothing to me is more heartwarming than seeing a kid who I may have treated, say, when they're like 3, 5, 6 years old, something along those lines, and then they grow up. And one of the neatest things I've seen so far is some of these kids who have grown up into adults, and they've said, you know what, I want to tell my story. I had a rare condition, nobody really knew what to do, came through, had treatment, and now I'd like to tell my story to other kids, little kids, coming along down the road. And a lot of these former little kids, now adults, have become major advocates and have gone on to help lots and lots of families with younger kids develop, get treatment, get through the whole process and develop into adults too. So I think that's really cool. When I'm not working in the hospital, one thing I like to do is scuba diving, which is really fun. It's gotten me to some really interesting parts of the world, and it's been great. My 2 kids are certified divers too, so it's been a great family thing. Lots of fun for us to do. And it's a wonderful thing to do with all kinds of people, every age. In my family, all kinds of people in my family are divers. We've been doing it for years, and it's a lot of fun.